I'd like to welcome to the JPP, the Jewish Philanthropy podcast, my dear friend, my neighbor, Avishai, Dr. Avishai Neuman. Avishai wears many hats. He is the president, I think, and proprietor of Centurion, which is he'll tell us about the grasp and the length of his company in terms of providing anesthesia across the United States. He's a trained medical doctor and a physician, and he also is a very devoted Hatzolah member, both Hatzolah on land as well as Hatzolah Air, which we will talk about. He's a very special person. He's really, really devoted to the Jewish people, to the community, and it's a kavod gadol to have my friend Avishai on the podcast this morning. Welcome, Avishai.
Thank you. Wow, never had such an introduction like that.
Your
I'll
mom.
come on anytime.
Your mother would say that.
Exactly.
And we have to point out also that he's our 86th podcast episode, and the number 86 is very special to him. He'll tell us why number 86 is so special to him.
It just so happens that my Hatzolah number is RL86, and that I synchronized my license plate. So my license plate's 86. So it actually works out really nicely.
Amazing. I'm really just pleased that I have Avishai for a few minutes, because other than a late night tennis court match, I've observed it. I've had a meal with him. He's constantly getting Hatzolah calls, so we're taking up valuable time here. We're going to try to be as efficient as possible. So Avishai, tell us just a little bit about your background, your own words. Tell us about growing up, just a little bit about your educational background, etc.
Sure. So I grew up in Queens. Most of my childhood was spent in Jamaica Estates. I was born in Hillcrest, and started out in YCQ. Then I went to Yeshiva Sackler here in the Five Towns. From there, I went to MTA. After MTA, I went to Yeshiva Kotel for 2 years. When I came back, I started learning in Orach Chaim in Queens, and was in Queens College at the same time. And then from there, I went to medical school in Israel. I went to Sackler. I lived in Tel Aviv for 4 years.
Oh, wow.
And then from there, we came back. We were probably going to move to the Five Towns. It didn't work out. We went to Kew Garden Hills for 2 years. And then after 2 years in Kew Garden Hills in 2008, we moved to North Woodmere, and we've been here ever since.
Fascinating. So tell us a little bit about when you decided to become a doctor. Kind of, was that always your passion to go into the field of medicine? You're obviously you're in the field of medicine. You're also a businessman, but kind of like early on in your development, what were you thinking for yourself professionally?
So I think that my probably earliest experience, and even like thinking about medicine, I was in 7th grade playing football in South Shore, and I shattered my elbow, and I ended up in the hospital having surgery.
Oh, yeah.
And I think all kids at that time, you just you're like in awe. You've never experienced, or I had never experienced, a hospital or medicine or healthcare, and that, I think, maybe piqued my interest at a very young age. But at that time, really, who knows what they want to do when they grow up, but at least, it planted a seed. And then as I went through high school, I remember, this probably, is a story that many people have experienced, but I was in a shul, in a shtivel in Forest Hills, and there was a child that ran outside and stepped on a beehive and was stung multiple times. And the child, his parent was allergic to bees, so he didn't run out to go get him. So we ran and brought him inside the shtivel, and they called Hatzolah. And really, nobody knew what to do. We were all standing there, stunned, looking at this kid who was screaming in pain with bee bites all over the place. And the father was 6 feet away from him, because he didn't want to come near him, for fear of being stung. And I remember just the Hatzolah guys flying in and literally picking this kid up and putting him in the ambulance and zipping to the hospital. And I think I was in 10th grade at the time. And I said to myself, I'm like, this is crazy. Nobody knows what to do here. And we felt so helpless, just standing and staring at this kid, Neva, who's having, just intense pain. Anyways, that prompted me, I think, to take a lifeguarding course and first aid and CPR. This is probably around 10th grade. I did that at the Y in Forest Hills. And then sort of one thing led to another. The next year, I came back from Israel. Somebody offered me the opportunity to take an EMT course at Yeshiva University. I was an MTA. It worked out. I started taking the EMT course on Sunday. And that, it just, one thing led to another. And I think once I started down that path, it was just, I was all in. In my mind, I'm like, all right, this is what I want to do. This is my mission. I feel it. I like it. it gets my blood going. And some people want to run away, and some people want to run in. I'm, I guess, one of those people that likes to run into the fire. So that's how I think what got me to that point, and then from there, just pre-med and I continue doing Hatzolah. I volunteered for Magen David Adom. I became a lifeguard. I was a lifeguard instructor. I used to arrange lifeguarding and CPR courses as a newlywed after I got married. While I was in Queens College and Or Chaim, I was doing this to make some extra money. I used to teach in some of the high schools, Yesodei Yeshurun and HAL, DRS, which was at the time in Central Avenue, South Shore, and some of the other schools, and I really it just kind of came to me.
Wow. So really, I mean, it's beautiful when we merit on occasion to really, not everybody does, to genuinely find what makes them tick, what gets them excited to get out of bed in the morning. And obviously you had a natiya toward that, coupled with various experiences that pushed you along that path. So that's incredible. Who would be some of the role models, people that you look up to, people that inspire you in your day-to-day life? It could be in this realm that we're talking about in terms of life saving. It could be just a bigger picture, people that have been impactful in your life.
It's interesting. I grew up, like I told you earlier, in Jamaica Estates. We had a lot of doctors in the community, and at the time, it's for me, sort of in that headspace already, I looked up to a lot of those physicians, and a lot of them did more than one thing. There were actually quite a few impressive people in the neighborhood who were not only physicians, were not only, they were Bali Tefillah, and they davened the Yamim Noraim, and they laned, and they had all these sort of extracurricular hobbies. And that was very interesting to me. I mean, I would tell you that also, my parents were, on sort of like on another level, also, very open. We had a very open home as a child growing up. There was never no to a guest. There was always, looking for opportunities to reach out and do chesed, or if there was something communal, they were very involved. And, the community itself in Jamaica Estates, I don't know if you know, the time the youth director was Sammy Herskowitz, and we took a lot of pride in the shul and in the youth department. I was very involved in that as a child growing up.
This is Rabbi Hochberg shul.
And Rabbi Hochberg, yeah.
I know the Hochberg very well.
He's a rabbi's rabbi. I mean, he's about as amazing as they get. Really, also, kind of jack of all trades and master of all trades. So he was also somebody very, very inspiring. So I think I took the cues from a lot of different angles, mostly, within my, I would say, Dalet Amos at the time. And then as I grew up, sort of expanding that and seeing people who were successful, not just in one area, but in many areas. And I think, it's interesting when you see and you try to aspire to, success breeds success, trying to be around that element. I always tell my children, if you want to be a winner, you got to hang out with winners.
That's great. I like that. It's true. No, we all definitely are impacted by our sviva. I'll share this with the listening audience. So it's interesting. I moved to North Woodmere almost 6 years ago, and I remember right when I moved in. So we didn't know each other yet, but I remember like a week or two after we moved in, or maybe within 6 months, I don't remember exactly, but it was soon after we moved in that you were celebrating a Siyam Hashas. And there was a special, I think it was in memory of your father, if I'm not mistaken. And there was
he was there. It was in honor of my father.
It was in honor of your father. Okay, wow. And it was a Chanaz Sefer Torah. But I just want to point out, without embarrassing you, that obviously, Lima Torah, in terms of, we talk about success in various realms. I think that's something that, I see today that maybe I didn't see as much growing up. I used to think kind of like you had to be like either, you're either a Klei Kodesh or you were, you're a balabas. But that kind of synergy or the hybrid of kind of excelling in both realms, spiritual and physical, I didn't see as much, in my youth. And I think today it's rampant in an amazing sense. There are people who are really excelling in multiple endeavors, and I find that to be incredibly inspiring.
Yeah, it's it's if you're exposed to it, it's very inspiring. And I'll tell you that I remember when I started medical school, I think actually I was in college. A good friend of mine, Dr. Ellie Bennett, who many people I'm sure know from Kew Garden Hills. He's a well-known emergency medicine and internal medicine doctor, and we've been friends since after I came back from yeshiva. He picked up a Gemara. He was in medical school, and he was studying for his boards. And I remember seeing him walking around with the Daf Yomi and USMLE, first aid for step one, which is the board review book. And I'm like, Ellie, how are you able to fit in a Daf Gemara, and do the boards at the same time? And he said, this is just part of the program, the first X number of hours I'm sitting, and so that actually was very inspirational. I remember thinking to myself, damn it, if he could do it, I'm going to do it too. So
Right.
It took me a few years to get on board, but he's still doing it, and thank God, with the help of Rabbi Rosner, Rabbi Leibowitz, and some other people along the way, was able to get into the Daf Yomi cycle, starting my third year med school.
Wow, no, it's great how we leverage each other, kind of how we all kind of, if you're around the right people, 100%, it definitely they lift us up. Let's I want to talk a little bit. I have so many things I want to talk about. I want to talk a little bit about. I like to talk about challenges and opportunities, and challenges and successes, but maybe we'll even fast forward a little bit, because I know a challenging time in all of our lives was COVID-19, and I know that you were on kind of the forefront of saving lives and helping people to the best of your abilities. Do you want to maybe just shed some light in terms of that kufa, that period in our lives as a medical professional, and in the capacity that you serve in the community? Kind of what I imagine that was an incredibly challenging period of time.
Yeah, it's. I'll give you a little bit of background. I'll just talk so to kind of zoom into this area. My background as a physician, I'm an anesthesiologist by trade, and like you said, I've been in Hatzolah for about 25 years now, since 1998. So COVID. So let me just one more sort of preface to that is that, what do I do professionally as an anesthesiologist? I used to work in the hospital, doing pretty much everything and anything other than heart surgery. I more recently focused my practice on ambulatory and outpatient anesthesia. So we're used to setting up basically offices, operating rooms and offices. We would take somebody's office and turn it into a setting where they can do procedures, and we sedate the patients. We put the patients to sleep. So that's sort of my background: outpatient ambulatory anesthesia. That's what my group does. That's what we're all doing. So when COVID hit, all elective surgery and procedures were basically shut down. I don't know if you remember, but there was a state mandate that basically said we need to take all our medical resources, all the resources that we have in the state, and shift them to the hospital, because they thought we were going to be seeing hundreds of thousands of patients in the hospital, and many, many thousands of patients on ventilators, which we did see. Thankfully, not the numbers that they were predicting, but 85 to 90% of my business, of our practice, was shut down.
Wow.
From just from a professional standpoint. And so we had to figure out, well, what do we do with these people? We're all skilled in airway management and ICU management, critical care. There's got to be something that we can do to help to help ourselves, to help the city, to help to help our community. And so, with the help of one of the Hatzolah guys here, who's involved with the Office of Emergency Management, we were able to shift our team, our anesthesiologists, into the city hospital system. I think there are 11 city hospitals, so we were staffing either 7 or 8 of them, and assisting them on the floors, taking care of patients in the ICUs, and in certain situations in the operating room. And so that, on one level, professionally, is what we were doing. And then on another level, with Hatzolah and Hatzolah Air, again, early on, the signs were very ominous. We saw images from Italy of hospitals being overrun with patients, and major staffing shortages, and people and patients on ventilators, and we're like, "This is no way this could happen over here." Right. And then as it started unfolding, Ellie Rowe, my partner in Hatzolah Air, and Yaakov Gade, they said, well, what if we get to a situation over here? And what do we do? Where are we going to go if the ambulances are lined up outside the hospital? And so we shifted into, we need to do something for our community. And that's how we got to, turning Shar Yashuv into a makeshift hospital, clinic, whatever you want to call it. At the end of the day, we were preparing for the worst and hoping for the best. And so, that was one challenge. Another challenge that we had, especially with Hatzolah Air, was the plane stopped flying bodies to Eretz Yisrael for Kvura. And so we arranged many of those flights. And at the same time, because those flights weren't going back and forth, patients that were coming in to the States for medical treatment weren't able to get here. So we would fly, Mason for Kvura to Eretz Yisrael and fly patients back for treatment. So it was really an amazing opportunity for us to really, help all those in need.
Avishai, let's take a step back. So let's open up a little bit the conversation about Hatzolah Air. Hatzolah Air has, I think it's gotten some ado in some of the publications. I think I've seen articles in the Mishpacha or Ami, those type of publications, and I think it has a greater social media presence today than it certainly did a few years ago. But I think a lot of us would love to hear more, just kind of like, how did Hatzolah Air begin? Is it connected to other Hatzolahs? Is it like, how does what was the vision for it? How did it actually happen? It looks kind of cool with like the private jets. How does the whole thing kind of like operate? And then of course you'll tell us about, some of the different amazing experiences that you've been privy to.
So it's a great question. I'm going to give you, the 30,000-foot view, no pun intended. Ellie Rowe, who's really the brains and the will and really everything behind it, is a pilot. And he's been a Hatzolah paramedic for probably 30 years. And people used to reach out to him whenever there was an issue that patient needed to be flown. Because, there are commercial air ambulances, but a lot of times it requires a lot of red tape and requires, insurance and this and that makes it not so easy to access as quickly as one would need it. And so he was called on, from very early on. I remember flying with him in a small little plane back when I was in medical school in, let's just say, the early 2000s. And people would call him, we have a patient, somebody needs to go from here to there. And he would do it as a total chesed. Fast forward 2016, I'm already practicing. I'm an anesthesiologist. There was a girl in Canada who had come from Israel. She was after the army, and she ended up in an ICU. In Toronto, and her parents flew in from Israel, and she had what they call autoimmune encephalitis, which is basically an inflammation of the brain, almost the body attacking itself. And there was really no treatment for her. The treatment essentially was time. We call it tincture of time. And so she needed to get back to Israel. They reached out to Ellie, and Ellie reached out to me. He said, this girl is in an induced coma, and she needs to get back to Israel. Can we put this together? And again, with my experience putting together basically operating rooms in people's offices, I said, sure, we can do this. Long flight, even though she was on a ventilator and she was being sedated. This is right up my my field, right up my line of expertise. And so we did that flight to Israel. And I remember, leaving the hospital in Toronto. We chartered a plane. We brought all the equipment. We, brought her to the hospital where I was a medical student and I had trained in Israel. We took her to Tel Amer. And I remember really feeling like you feel like $1 million. You walk in and then everyone's like literally cheering that you brought this girl home, this patient home, so that she could recover in Israel with her family, not in a foreign hospital. And that was probably the impetus. I would say, at least, for my involvement. 2 years later, Ellie called me up. He said, I think I want to, turn this into a division of Hatzolah. We know we have Hatzolah all over the world. We have it in New York, in New Jersey. There's a branch in Chicago, in Los Angeles, in Miami.
Tell me just a little bit, just because I'm reading now, I just started reading Eli Beer's book about, his biography about United Hatzolah. And I've seen even some social media connections, so how does that, it's all connected?
Eli Beer is a friend of mine, a great, really also an inspiration. His branch of, he is one branch of the many Hatzolahs throughout the world, and that is Ichud Hatzalah.
Okay.
And within Israel, they're the largest branch of Hatzalah.
Got it.
They've connected, many communities that were fragmented, but there are still within other communities. Let's just say Hatzalah Beit Shemesh, for example, or Hatzalah Shari Chesed, or Hatzalah B'nai Brak, are not part of Ichud Hatzalah.
It's different.
But it's another branch of, let's just call it worldwide Hatzalah.
Okay.
And so Hatzolah Air, if you think about it, is another branch of Hatzalah. The only difference is that we work, intimately. We're connecting almost the dots between all the branches of Hatzalah. Ichud Hatzalah has a branch in Panama. When we fly to Panama, we're working with the Ichud Hatzalah guys in Panama. If we fly the patient back to Lakewood, we're working with Lakewood Hatzalah. If we're flying,
it's collaborative, but it's independent. That's
yes. Each branch is its own unit, so to speak. Mm-hmm. And the amazing thing about Hatzolah Air is that we get to work with all of them.
Interesting. Wow. Okay. So I was just actually interesting. I don't know. I'm sure you know about almost all the cases, right? Like I was just seeing, I think Hillel Fold was recently sharing on social media about some amazing case where something in Mexico. I forgot exactly. Just he was at a Pesach hotel. Do you know this particular scenario?
He called me, so I know the story.
Okay, so I don't know if he was sharing it. So you have probably a lot of amazing stories like that.
Hillel's just so good at really articulating it and putting it out there and inspiring people. But there are many stories like that. Many go unnoticed and many people don't even hear about. Some of them, turn out really positive. Unfortunately, some don't. But at this, at the same time, we want to be there, for all those cases, wherever possible. Again, what's amazing about what Hatzolah Air does is we go to places where there is no Hatzalah. In this particular case, Panama Hatzalah did an amazing job by getting this child from wherever he was to Panama City, which is the major hub in Central America, and getting him the care that he needed and contacting us. But Hatzolah Air, we've flown to Colombia during COVID. I flew to northern Colombia to pick up a patient that was stuck there and needed to get treated in the United States. We flew to the Ukraine, to not to Moldova, to Kishinev, which is Kishinev is in Moldova. We flew into Yassi and met the team from Moldova. We picked up patients at the beginning of the war from Kiev and flew them to Israel. On the way to Romania, which is where we landed in Yassi, we brought them like 7,500 pounds of supplies. And so, that was, and there, Ichud Hatzalah was on the ground. So we were able to help Ichud Hatzalah in that situation by bringing them, needed supplies. So that's sort of how, what's so special, I think, about Hatzolah Air is we really have the privilege of working not only with all the Hatzalah branches, but even getting to places where there is no Hatzalah, but people do need assistance and do need help.
Talk a little bit just about the infrastructure. Like, what are the needs of Hatzolah Air today? Like, is it growing? Are the needs? Do you see that there's more of a need?
We started with one plane in September of 2019. Mm-hmm. Can I pause for 1 second?
Yeah, sure.
Dr. Neuman? Yes, this is. Yeah. She's traveling. Can I ask her, can I call you back in like 25 minutes? I'm just in the middle of a meeting. I'll be done in about 20 minutes. Okay. Yeah, call me back at 12 o'clock. Thanks, man. Sorry about that. I saw them.
No problem. Yeah, so it just started in 2019. Okay.
So in 2019, we started with one plane. Actually, I did the first flight with a patient from Florida to New York, who's a cancer patient who was here at Camp Simcha, and he had come to Florida with his parents and his siblings, and we flew them back. And then our first official flight was in September of 2019. We brought Rabbi Yitzi Horowitz from Los Angeles to New York. I don't know if you know Rabbi Horowitz, but he's a Chabad shliach who unfortunately developed ALS,
Right.
and we flew him to New York for his son's bar mitzvah. So that was really our first flight. Since then,
I have to interject. Like, aren't you nervous? Do you get? I guess there's adrenaline pumping when you go on a call, and I don't know where nerves play into this. You've been doing this for so long, but I would just imagine being on a plane going to Israel with a high risk patient must be particularly nerve wracking. Like, I don't know. Like, what do you do if something goes wrong? You're kind of limited, right?
it is. That's why you need people who are experienced in dealing with problems and troubleshooting problems, and people that have the knowledge with utilizing whatever resources you have on that plane. Because in the best case scenario, if you have to land somewhere, you could be over the Atlantic and your closest destination is 3 hours in either direction. So it's definitely nerve-wracking. And I will tell you that even with my experience, I've had patients on the plane. We were flying from Israel to the United States. We had a baby who was coming for a specific heart condition to Boston Children's Hospital, and it was quite nerve-wracking. Quite nerve-wracking.
Have you had to stop like mid-flight and reroute to places to land? Has that happened to you guys?
We've definitely had to reroute, and then right at the end of last year, somebody else donated a larger plane, a G550, a Gulfstream, that is able to do New York to Israel nonstop and back. And so we now have a fleet of 4 aircraft, and we have a number of paid hired pilots that are on call pretty much 24/7. And we've got a long list of volunteers, starting from the people that are answering the phones, the coordinators, the case coordinators. There are a number of women who are really special and talented and just give of their time, so much time. Each case could take hours and hours, the logistics and the planning. And then we have people in operations, in terms of aviation, people that donate their time to coordinating, and getting the flight plans out and making sure that the permits are there. And then you've got, people like Ellie and some other board members that are involved in helping raise money for this organization, which is not cheap, as you can imagine. An hour of flying time can cost, anywhere from $3,000 to, let's just say, $7,000, depending on the plane that you're flying.
Wow.
And so these flights are not cheap, but unfortunately they're needed.
Just because we are a philanthropy podcast, so it is of interest to me in terms of, do you find, as one of the lay leaders who's involved presumably in raising funds for this endeavor, like, do you find, what's the response of people? Do you find it's never easy to raise money, but what are you finding out there? Like, when you're sharing the vision, sharing what you're doing, do you get pushback from people? What are you seeing in terms of just how easy or hard it is to raise funds for Hatzolah Air?
With any new organization, you're always going to get skeptics. And I think there are probably a lot of skeptics, and people say to themselves, really, do we really need to raise money for this? Is this something that's needed? And then you hear a story like this one in Panama, where we were able, the next morning to go pick this patient up and get him to Cohen's Children's Hospital in New York. Or you have a situation in the Bahamas. We had a boy that actually was in Mexico. He ended up with pneumothorax, which is air around his lung. And he showed up at the first clinic, and they basically told him, $10,000 or we can't treat you. And he didn't have it, and they turned him away. And he went to another clinic, and they told him $5,000, and they gave him, their credit card, and they were able to put a valve in, and they basically said, okay, this is the cost per day for you to stay here. And we went down and flew him back the next day, to Florida. And so there are many stories. I feel like, it's a good plug for people to take travel insurance, because it is expensive. But at the same time, if you or your loved one is somewhere, far out, and you have a medical emergency, you're not getting, the best healthcare wherever it is that you may be. you need to get back to, America or wherever it is that's close to you to get you top level care, or to get your loved one for that matter. People call their parents broke their hip, or somebody, had a stroke, and now what? You're in a hospital in Puerto Rico. You've got no family there. There's limited Jewish resources over there. You need to get back to the United States.
Right.
And so for the people that have experienced it, it's a no-brainer. Or the people that know people that have benefited from Hatzolah Air. And as we do more flights, I think people are coming to realize that this is something that really is needed. Today, think about today, how many trips you take a year, how many flights you take. Compare it to 25 years ago when you were, a teenager, or when you were a child. How many times were you on a plane a year? Once, twice, 3 times? I mean, there are people that fly back and forth to Israel every week.
Right.
My orthodontist, Jonathan Pillay, is
Right.
here every week. My dentist, flies every week. So the world's changed and the needs have changed, and we're trying to meet that need.
No, it's beautiful. Yeah, I wish you continued success. How would you compare or contrast it a little bit to what we'll call Hatzolah land or Hatzolah ground? Do you find that, does that get old after a while? Is that like...
No, listen, anytime we save a life, it's like saving a world. And I still get that same, sort of like your heart rate goes up a little bit when there's a call and it's down your block and somebody's in need of care right away.
Right.
Definitely you get used to it after many years. But I still, like I said earlier, I'm still part of Hatzolah here in the RL in Rockaway Lawrence, and I'll go on calls throughout the city. My role's changed a little bit, from an EMT to a physician, and having the experience and having the knowledge to be able to see things in a little bit of a different light definitely gives me a little bit more perspective. And for those patients, that I'm treating, it's a different level of care. But we have a number of physicians, in Hatzolah throughout the city. Dr. Bennett, like I mentioned earlier on the podcast, he's still in Queens Hatzolah, and Shimshi Zimmerman is he's the medical director. He's also a physician, an emergency physician in Brooklyn. I mean, there are a number of doctors throughout Hatzolah, but again, we just, there's a lot more exposure to Hatzolah on the grounds. You see the ambulance zipping by, you see cars flying by, going to emergencies. It's just a different type of emergency. It's a different type of situation. It's needed. It's amazing. I mean, we're privileged. People, especially you and I, could you imagine, not having Hatzolah?
No. Right. No, it's interesting as we're talking it out. Like, the truth is that Hatzolah, I'm calling it Hatzolah ground. A regular Hatzolah is that usually, right, that immediate responsiveness. Hatzolah Air, you're dealing with a crisis, but by definition, it's going to take some time, right? It's not going to be an immediate intervention. You're transporting, you're dealing with the sensitive case. So by the whole, both are life-saving, but in very different, different ways, right? I want to. Oh, sorry. Go ahead.
I'll just say, there are certain situations where somebody needs an organ transplant or needs to get to an organ, and those are the type of situation that you're describing. Again, it doesn't happen that often, but it does happen, and we're also there.
I was just watching a clip this morning, just because you mentioned that. So we all know about the terrible tragedy that happened over Pesach. The D family was murdered. Terrible, criminal, just terrorism, just the worst of the worst, and very painful for the world at large, and certainly our communities. I just saw this morning a beautiful clip of the remaining D children and their father meeting the heart recipient. Their mother's heart was given to a woman in Eretz Yisrael, and the daughter was like listening to her mother's heart. It's a clip that's going around. I actually posted on my WhatsApp. Very, very powerful. So I'm glad you mentioned that in terms of the impact of being able to save lives like that. There's somebody right now who is close to our community, who I understand is hoping and waiting potentially to get an organ transplant. So these are, I won't say ma'asim b'chol yom, but these are important things that you play a role in. So kol hakavod.
Let me just add to that story. I don't know if you know this, but Hatzolah Air has collaborated with Magen David Adom, and we brought them 2 helicopters about a month and a half ago.
I saw it on social, but I don't know the context exactly.
So that's the context. The context is that we raised the money for the helicopters, and donated already 2 of the helicopters to Magen David Adom, and they're operating the helicopters. One of those helicopters flew Mrs. D, I don't know her first name, Allah Shalom, to the hospital.
Oh, wow.
And was responsible for extending her life for those 3 days, because probably if she would have gone by ground, she may not have made it.
Wow. Were you actually involved? Were you actually consulted in that particular transfer or no? That just...
They're operating. Magen David Adom is actually operating the helicopters. They're managing and operating the helicopters. But if you see the clip of the video of them taking off, you'll see Hatzolah Air's logo on the helicopter.
Oh,
so
wow.
It's an active collaboration. And when we were just in Eretz Yisrael, before Pesach, we actually took a flight on one of the helicopters that we brought to them. Yeah, it was pretty amazing.
Oh, kavod. Let me ask you this question, because I think it's many of us struggle with it, and I can only imagine you might struggle with it in terms of work-life balance, in terms of whether it's, your regular job or whether it's all the volunteerism that you're doing. I imagine, particularly when you're flying all over the world, it must be difficult to find requisite time for, for family. How do you manage kind of the tension between, personal obligation and professional volunteer roles?
Well, first of all, my family gets a lot of credit. Definitely my wife, definitely my kids, for putting up with me, and putting up with the running around. And, one of the most, I think, impressive things about anybody that you meet who is successful is their ability to manage their time.
Right.
Time management is so key to success.
Right.
I think in whatever walk of life. Sometimes I look at our Rav, Rabbi Leibowitz. I mean, it literally, maximizing every minute of every day. Shiurim. I don't even know when he has time to prepare for the shiurim, but maximizing your time and managing your time efficiently is really a key to success. Obviously, trying to be in the moment. When you're home, be home, and when you're at work, be at work. It's definitely hard to. Even for myself, I mean, I say it, it's easier to say than it is to do. But when you sit at the dinner table, put your phone away, or when your kids are speaking to you, try not to look at your text messages as they're coming through. And my daughter will pull me aside. She's like, pay attention. and sort of brings me back to the base. But I think that that combined with a little bit of ADHD that's innate in me has helped me sort of, do a lot of different things. And in my mind, they're all, sort of organized, even though they may not seem like it. But those, the time management skills and trying to, my motto, work hard, play harder. Even though I am flying, I do try to take time to spend with my family. I saw you, one of the things, you say, what are your hobbies? One of my hobbies is I love to ski. I grew up skiing and I raised my kids skiing.
Cool.
And every year we spend a week, with the family skiing. And so I think trying to balance, intense work with intense, focus on family, even though it's not as spread out as, probably most other families do, where, dad is home or the husband is home, every week, and not traveling.
I once heard somebody say that quality is quantity, right? Or quantity can be quality too, but it right, but it is interesting.
Yeah, so I think that's, I would say, how I manage that work-life balance.
So I know tennis is a hobby. I know skiing is a hobby. Anything else that people wouldn't guess?
I play softball. We just won the softball championships last year with Jordan Hiller and the North Woodmere crew.
Yes. Okay. What position do you play?
Second base, pitcher.
Got it. Okay.
Yeah.
You're righty. You're right-handed pitcher.
What's that?
You're righty or lefty?
Righty. I switch hit, but I throw righty.
Okay, good. As we wind down over the next few minutes, I'd love to get your insight and perspective on philanthropy in general, right? I know you're involved, obviously, very closely to both Hatzolahs. I know firsthand in the community that you're involved in other endeavors as well. Talk a little bit about just your Weltanschauung or your perspective on philanthropy, Nobody has unlimited time, as we've talked about. Nobody has unlimited resources. How do you kind of assess? I just had a funny story last night. Two gentlemen knocked on my door. I don't know about you, but I don't get people knocking on my door so much in North Woodmere, like on a weekly basis. Maybe you do, but it was interesting. It was like a funny thing. I think they came in the same car. It was like I started asking them. They came like one after the other. It was like a little bit of a setup, and it was very cute. My children were watching this, and I asked. So I gave some money to the first guy. The second guy comes, and my kids are watching this, and my 7-year-old Malachi. I said, Malachi, can you run upstairs and get my wallet? Because I brought down money for the first guy. I didn't bring down for the second guy because I didn't know there was a second guy. And Malachi he brings out my wallet. He like takes out all the bills in the wallet. He starts like he wants to give away my whole wallet to this guy. I'm like, Malachi, relax, let's relax a little bit. But how do you kind of in your mind, how do you triage different causes and what are you most passionate about? What do you feel like, hey, this is super important, but it's not necessarily my thing? Kind of how do you assess that?
First of all, that's great chinuch if your son's running down with your wallet and giving away all your money.
He's very generous. He's very generous.
Yeah, that's amazing. I think that we're all given a task in this world, and I think it really speaks to how people view money. Thinking about what your role is, and if Hashem gives you money, how responsible are you going to be with that money? If we're given the opportunity to, and I always tell this to everyone, my kids, our friends, we always want to be the givers. We always want to be in the position to be able to give. And if somebody knocks on your door, I try to make them see, look at, this is a privilege for us to be able to give and not to be the person knocking on somebody else's door.
Right.
So I always, try to give, let's just say, random people something. I don't want to, turn people away totally empty-handed. It definitely is becoming a little bit more popular for, people to knock on your door and then,
Is that becoming a thing in our neighborhood? I see it in the shuls a lot. I don't know, but it's interesting.
Yeah. And again, it's hard to know, and it's hard to really.
Let's give a plug. Let's give a plug for North Woodmere that we are arriving as an Ir Ve'eh Yisrael. Baruch Hashem.
Amazing. It's amazing. It should be a giving community. Amen. And recognized as such. But it's definitely challenging. Today, there's so many charities. There's so many, raise-thons and charity campaigns and bike for chais and there's so many amazing organizations. I mean, the truth of the matter is that find me another community in the world like the Jewish community that pushes tzedakah and such a strong focus on making sure that everybody's taken care of. I mean, it's really amazing to see. There are obviously things that obviously are near and dear to me, like Hatzolah, that not only do I give my time to, but I give money to as well. There are so many organizations that are medical organizations that as a physician speak to me, and I know what exactly they're doing. As a teenager, I was a counselor in Chai Lifeline, and so I got firsthand experience in camp and on their trips and on their weekends and seeing what they're doing. And I think when people are involved in charities and charitable organizations, it opens them up to what really goes on, and they'll either choose to to give more, or sometimes maybe not. But there, and again, the community organizations, if you've been touched by a community organization like Tomchei Shabbos or Amudim or Achiezer, any one of these things, I think that people are automatically drawn to want to give back, especially those people that can give. And when they see the amazing work that they're doing, if they're, have a firsthand experience, it definitely lends to. And then there's on top of that what people feel like in their heart. If they're, gung ho about yeshivas and about Talmud Torah and about kollalim, there are people that just give to that. If you're the Wolfson Mishpacha and you're supporting Olami and bringing Jews back to kiruv organizations, there's that. In medicine, I always tell, aspiring physicians and doctors, there's a field for everybody. Even if you go to medical school and you graduate and you don't practice medicine, There's a field in business for you. There's a field in pharmacology and in research and so on and so forth. So tzedakah, I think in today's world, we have that as well. There's got to be a tzedakah out there that speaks to somebody, speaks to everybody. Don't tell me, if you're a philanthropist, you'll figure out where you want your dollars to go.
All right, no, that's true. Let's end on that point. It's a little bit. Let's go back, but just I think, if I'm not mistaken, you're also a businessman, right? In the sense that you run a business end of the medical piece. So talk a little bit about just kind of how that. I don't think that's so common for most doctors. I mean, every doctor runs his practice, and maybe are you? I think you're more than that. Or maybe you're not, but maybe speak to that a drop if you would.
So. I have a group of anesthesiologists, and we provide services to surgery centers and offices, like I mentioned earlier. And I think, from the time I was pretty young, I always had that entrepreneur instinct, is almost what it is. And on the one hand, and on the other hand, I'm a little bit more prone to taking risks. And if you combine those two things, sometimes with, not sometimes, but with mazel, you can really, propel yourself. And so I think it was just a combination of all those things. That and when I started out, if you would have asked me, 10 years from now, where do you see yourself? I never would have pegged where I am today, 10 years ago. But as you, I guess, grow and develop, and as we started, one thing led to another. We took care of one surgery center, one office, another surgery center, another office, and there were failures along the way. I had a sleep center that we built in Floral Park. I had a pain management practice that I ran for a few years, and we did well. And then, the insurances changed their reimbursement, and we had to pivot away from that. Not being, averse to taking risks. I think I said that in a backward way, but you got to be willing to take risks.
What is it in your nature? Maybe it's the skier in you. What's in your? But that's the same. What in the root of? Some people are risk averse, some are less. Like, what do you think about yourself?
I think that's just it's in your personality. Some people are just more conservative. Many doctors tend, to want to go to medical school. They want to treat their patients. They want to work for a practice, or maybe they want to work for themselves, but they're not necessarily interested in going to the next level. Mm. And I think I saw opportunity, and I think I took it. I saw that I found, that I had a skill set and ability, and I wanted to hone on it and kind of just keep running with it. And so that's really what I did. Ultimately, I had these other practices that were not successful, that did fail, and I just used it as another stepping stone. This didn't work, we're going to go on to the next thing. But at the end of the day, coming back to what I really, love and know how to do and I'm good at, and amplifying it, is what got me, today to where we are as a group, as an anesthesia group. We are probably, I want to say, number one in New York City in terms of, the size and the scope of our practice, in covering, over 20 surgery centers and many offices. We work with NYU, we work with Mount Sinai, New York Presbyterian. And so that's really, I think, and a lot of siyata d'shmaya, obviously, that goes without saying. So.
Sure. All right, Avishai, I want to thank you so much. We could obviously have a longer conversation, but I think we definitely touched at least the Rashi Prakim, at least the headings, and I'm glad that we had the opportunity to bring to light, in particular, the great work of Hatzolah Air. I want to wish you continued hatzlacha, good health, siyata d'shmaya, and all your endeavors, and continue doing great things for Klal Yisrael. Thank you so much.
Thank you.
Okay, awesome, beautiful.